Have you ever woken up in the middle of the night, heart slightly racing, mouth dry, walking to the bathroom for the second or third time, and wondered, is this just aging, or is something quietly going wrong inside my body? I'm Dr. Mark Ellis, and I want to tell you something most people never hear until it's too late. Kidney disease doesn't announce itself with sharp pain. It doesn't scream for attention. It drains you silently, night after night, while you believe everything is still normal. In the United States alone, millions of adults are living with weakened kidneys right now, and nearly 9 out of 10 don't even know it. By the time swelling shows up in the morning, by the time fatigue becomes constant or creatinine suddenly rises on a lab report, the damage has often been building for years beneath the surface. And here's the most dangerous part. Many people do what they think is right. They cut protein, they avoid salt, they give up foods they love. Yet their kidneys continue to decline because restriction alone does not heal a tired filtration system that's inflamed, undercirculated, and stressed at the cellular level. That realization leads us to something surprisingly simple, but often misunderstood. Not a drug, not an extreme cleanse, but a familiar kitchen ingredient that when used the right way can support circulation to the kidneys, calm silent inflammation, and help reduce the metabolic burden that pushes creatinine higher over time. In this video, I'm going to walk you through 6 specific ways to use ginger tailored for people with weak kidneys to support natural detoxification, help stabilize creatinine, and assist kidney recovery from the root, not by forcing the body, but by working with its biology. And I strongly encourage you to stay with me until the end because one of these 6 methods is commonly done wrong, and that single mistake is why many people see no improvement at all. If your kidneys have been working in silence for years, this may be the moment you finally start listening and responding before irreversible damage sets in. One of the most overlooked moments for kidney health is not dinner. It's the first 10 minutes after you wake up. Because while you're asleep, your kidneys don't rest. They slow down. Blood flow drops. Filtration becomes less efficient. And metabolic waste quietly builds up in the background. I've seen this pattern countless times in my practice. A patient tells me, "Doctor, I wake up feeling heavy. My legs feel tight. My mouth is dry. I haven't even eaten anything yet, but I already feel tired." And when we check their labs, creatinine is often creeping upward, not because they ate too much protein the night before, but because their kidneys never fully flushed what accumulated overnight. This is where warm ginger water used correctly plays a very specific role. Not as a detox gimmick, not as a trendy cleanse, but as a circulatory reset. From a physiological standpoint, gentle warmth in the morning stimulates peripheral blood flow and reduces overnight blood viscosity. Ginger contains active compounds like gingerol and shogal that support microcirculation without forcing vasodilation. In simple terms, it helps blood move again smoothly, not aggressively, especially through small vessels around the kidneys. A small clinical observation published in nutrition and metabolic journals has shown that mild thermogenic stimulation in the morning can improve renal perfusion and reduce early-day fluid retention in older adults. That matters because better blood flow means the kidneys can filter with less stress, and stress is what drives silent inflammation. But here's where most people get it wrong. They make the ginger too strong. They drink it too fast. They treat it like a shot instead of a signal. The goal is not to kick the kidneys awake. The goal is to invite circulation back gently. A thin slice of ginger, warm, not hot water, slow sips, an empty stomach. When done this way, patients often report something subtle, but telling lighter legs, clearer head less, urgency to urinate later in the morning. Those are not placebo effects, those are circulatory shifts. And if you're listening to this right now, I want you to think for a moment. Do your mornings start with heaviness, dry mouth? That dull sense of fatigue before the day even begins? If so, this first step matters more than you think. But here's the critical truth. Knowing how to wake the kidneys in the morning is only the first layer of recovery. Because even if circulation improves during the day, there's another window at night where most kidney damage quietly accelerates. And that's where the next method becomes not just helpful, but essential. Earlier, we talked about waking the kidneys gently in the morning, restoring circulation after a long night of slow filtration. But here's what many people don't realize. What you do before bed often matters even more than what you do after waking up. I can't tell you how many patients have said this to me, Dr. Mark. I fall asleep just fine, but I wake up 2, 3, sometimes 4 times a night to urinate. They assume it's the bladder. They assume it's aging. Some even assume it's just drinking too much water. But clinically, that's rarely the full story. In people with weakened kidneys, nighttime urination is often a circulation and temperature problem, not a fluid problem. When the feet and lower legs become cold at night, peripheral blood vessels constrict. That forces blood back toward the core, increasing pressure on the kidneys to rebalance fluids, and the kidneys respond by producing more urine. This is where a ginger foot soak before bed becomes surprisingly powerful. From a physiological perspective, warming the feet activates vasodilation in the lower extremities. Ginger's volatile oils stimulate heat receptors in the skin, which signals the autonomic nervous system to shift toward parasympathetic mode, the rest and repair state. As circulation redistributes downward, renal pressure stabilizes, and the kidneys are no longer forced into constant overnight adjustment. A study in geriatric circulation research has shown that maintaining peripheral warmth at night can significantly reduce nocturnal blood pressure spikes in nighttime urination frequency in older adults. This isn't folklore, it's vascular physiology. I remember one patient clearly, a 68-year-old man who told me, "The moment my feet feel cold, I know my night is ruined." After just 1 week of warm ginger foot soaks, not hot, just comfortably warm, his nighttime bathroom trips dropped from 3 to 1. His sleep deepened. His morning fatigue eased. Nothing else changed. And notice something important here. We're not forcing the kidneys to work harder. We're removing the signals that keep waking them up. That distinction is everything. If your feet are cold at night, your kidneys are not resting. When your feet are warm, your kidneys finally get permission to slow down. But here's the part most people never connect. Even when circulation improves and sleep deepens, toxins still have to leave the body somehow. And if the kidneys are carrying that burden alone, recovery remains incomplete. That's why the next method, one that uses the skin as a second exit, can quietly change everything. In the last method, we talked about warming the feet at night so the kidneys can finally rest instead of being forced into constant fluid correction. But here's the truth most people never hear in a clinic. The kidneys were never meant to handle detox alone. As we age, one of the first systems to quietly weaken is the skin's ability to release waste through heat and sweat. That may sound minor, but physiologically, it's a big deal. When the skin stops helping, the kidneys have to pick up the extra workload, and that's when creatinine begins to rise without an obvious cause. I remember a patient in his early 70s who told me, "Doctor, I never sweat anymore, even in summer." He also had swollen ankles, heavy legs at night, and persistent fatigue. His labs showed declining kidney function, yet his diet looked fine. This is where gentle ginger steam becomes a strategic tool, not for relaxation, but for redistribution of detox work. From a biological standpoint, mild steam heat opens superficial blood vessels and activates sweat glands without triggering stress hormones. Ginger compounds, when inhaled through warm vapor, stimulate thermoreceptors in the skin and respiratory tract, enhancing peripheral circulation. The result is subtle but powerful. Water-soluble waste begins to exit through the skin instead of remaining entirely in circulation for the kidneys to process. Clinical observations in integrative nephrology show that light-controlled sweating can reduce extracellular fluid burden and ease nighttime kidney workload, especially in older adults who retain fluid but don't sweat easily. We're not talking about heavy sauna sessions. Those can actually strain the heart and kidneys. This is where people make mistakes. They push too hard. They stay too long. They chase sweat instead of listening to the body. The goal is light perspiration, not exhaustion. Just enough warmth to open a second exit for waste, urea fragments, mild acids, excess salts, so the kidneys aren't carrying everything alone overnight. One patient described it perfectly. "I didn't feel drained. I felt lighter." And that's the key signal you're looking for. If you're watching this and thinking, "I always feel heavy at night, swollen by evening, but dry and tired in the morning," that's often a sign the skin isn't doing its share anymore. Gentle ginger steam doesn't replace kidney function. It supports it by restoring balance in how the body releases waste. But here's the critical part most people miss. Even if detox improves recovery, can still fail if the kidneys are overwhelmed by what you eat at night. And that's exactly where the next method becomes a turning point for many people who thought they were doing everything right. In the last method, we talked about helping the body release toxins through the skin so the kidneys aren't forced to do all the work alone. But even when detox improves, there's one mistake that quietly cancels all that progress: what you eat at night. This is where many people unintentionally overload their kidneys. I've had patients tell me, Dr. Mark, I barely eat dinner anymore, but my creatinine is still going up. And when we look closer, the issue isn't how much they eat, it's what their kidneys are asked to process while they sleep. At night, kidney filtration naturally slows down. Blood flow decreases. Hormones shift into repair mode. Yet this is exactly when many people consume heavy proteins, salty foods, or rich meals that generate nitrogen waste acids and excess sodium, all of which must be filtered during the kidney's weakest hours. That's why light ginger porridge in the evening can be such a powerful reset. From a physiological perspective, a thin, low-protein porridge dramatically reduces nitrogen byproducts like urea that the kidneys would otherwise need to clear overnight. Ginger adds gentle warmth, supporting renal circulation without stimulating digestion aggressively. The result is simple but profound: less metabolic waste entering the bloodstream when filtration is at its slowest. Clinical nutrition research consistently shows that lowering evening protein and sodium intake can significantly reduce overnight kidney stress and improve morning creatinine stability, especially in older adults with declining renal reserve. I remember one patient clearly, a woman in her early 60s. She told me, "The nights I eat normally, I wake up heavy and swollen. The nights I eat lightly, I sleep better, but I'm still hungry." We replaced her dinner with a small bowl of ginger porridge, not bland, not extreme, just warm, simple, and light. Within 2 weeks, her nighttime urination decreased. Her morning swelling softened. And most importantly, she stopped waking up exhausted. Here's the key difference. This isn't about deprivation. It's about timing and metabolic load. When the stomach is light and warm, the nervous system stays calm. Blood circulates more evenly, and the kidneys can filter steadily instead of fighting spikes in waste concentration. If you're listening to this and thinking, "I go to bed full and wake up tired," that's often your kidneys telling you they worked all night without enough support. But here's what most people don't realize. Even with a perfect dinner, kidney recovery can stall if blood flow to the kidneys remains restricted from the outside. And that brings us to the next method, one that works directly through the lower back, where kidney circulation is most vulnerable. Up to this point, we've talked about reducing internal load, eating lighter at night, easing detox through the skin, and letting the kidneys work more calmly. But there's one factor that quietly undermines all of that effort, and it doesn't come from inside the body. It comes from restricted blood flow to the kidneys themselves. I see this pattern constantly, especially in people over 50. Long hours sitting, minimal movement, a cold lower back at night, sometimes air conditioning, sometimes chronic stiffness or dull ache that's been there for years. Most people think it's just muscle tension. Clinically, it's often much more than that. The kidneys receive roughly 20 to 25% of the heart's output every minute. When circulation through the lower back and lumbar region is compromised, renal perfusion drops. And when blood supply becomes inconsistent, filtration efficiency declines, even if diet and hydration look perfect. This is where ginger oil massage on the lower back becomes more than comfort care. It becomes circulatory therapy. From a physiological standpoint, topical ginger compounds stimulate local vasodilation and improve microcirculation in the tissues surrounding the kidneys. The gentle heat relaxes tight muscles that can mechanically compress blood vessels, while sensory nerve stimulation sends a calming signal through the autonomic nervous system. Blood moves more freely. Pressure normalizes. The kidneys receive steadier oxygen and nutrients. A patient once told me something that stuck with me. "Doctor, the moment my lower back feels warm, my whole body relaxes." And that's not imagination. That's neuromuscular feedback improving circulation. Research in vascular and pain management medicine has shown that localized heat therapy can significantly enhance regional blood flow and reduce sympathetic nerve overactivity, both critical factors for kidney health in aging adults. But here's where people go wrong. They massage too aggressively. They apply heat that's too strong. They chase intensity instead of consistency. The goal is not deep pressure. The goal is gentle warmth, slow movement, in steady rhythm, usually just 10 to 15 minutes before bed. When done correctly, patients often notice fewer nighttime awakenings, less lower back heaviness, and a deeper, more continuous sleep. And sleep, as we've discussed, is when kidney repair actually happens. If you're listening to this and thinking, my lower back is always cold at night, that's a sign your kidneys may not be getting the blood flow they need. But here's the part most people never consider. Even with better circulation and better sleep, silent inflammation can still keep creatinine elevated. And the final method addresses that hidden layer one that often decides whether kidney decline slows or continues. By now you've heard something important repeated in different ways. Kidney recovery doesn't fail because people don't try hard enough. It fails because something quiet keeps working against them in the background. Even with better circulation, even with lighter dinners, even with deeper sleep, many people still see creatinine stay stubbornly high, and the reason is often low-grade chronic inflammation inside the kidneys. This type of inflammation doesn't cause pain. It doesn't show up as infection. But over time it stiffens blood vessels, irritates kidney tubules, and interferes with filtration at the cellular level. That's why labs worsen slowly and silently. This is where diluted ginger with honey, used correctly and sparingly, becomes incredibly strategic. From a biochemical standpoint, ginger contains compounds that modulate inflammatory pathways and reduce oxidative stress. Honey, when used in very small amounts, provides natural polyphenols that help calm tissue irritation and support detox pathways shared by the liver and kidneys. Together, and this part matters only when diluted and used intermittently, they create a gentle anti-inflammatory signal without stressing blood sugar or digestion. I want to share a quick story. A patient once said to me, "Doctor, I don't feel sick. I just feel inflamed." He described heaviness, restless sleep, mild swelling, and labs that kept inching upward. We didn't add medications. We didn't increase supplements. We focused on lowering background inflammation. 3 times a week, very diluted, slowly sipped. Within weeks, his morning heaviness eased, his sleep stabilized, and his creatinine stopped climbing. That outcome is not magic, it's physiology. Studies in nutritional inflammation show that reducing oxidative stress can slow kidney function decline, especially in older adults whose renal tissue has less regenerative reserve. But here's where people ruin the benefit. They drink it every day. They make it too strong. They treat it like a cure instead of a support. This method is about timing and restraint, not intensity. Used too often, it overstimulates. Used correctly, it calms. If you're listening to this and thinking, my labs aren't terrible, but they're slowly getting worse, this step may be the one that finally changes that trajectory. But here's the most important truth I need you to hear. Even when inflammation is reduced, the kidneys can still fail if the overall rhythm of care is wrong. And that final piece, the one most people ignore, often determines who stabilizes and who eventually hears the word dialysis. That's exactly what we need to talk about next. If you've stayed with me until this point, I want you to hear this clearly. Weak kidneys do not mean the end of your independence. They do not mean your body has failed you. In most cases, they mean your kidneys have been working quietly for years, and they're finally asking for support, not punishment. You don't need extreme cleanses. You don't need fear-driven decisions. What your kidneys need is rhythm, warmth, circulation, rest, and consistency, the kind of care that works with your biology, not against it. Even small changes, when done correctly and patiently, can shift the direction of kidney health more than people realize. If this video helped you understand your body a little better, I strongly encourage you to save this video. Kidney health isn't something you fix in one day, it's something you return to, especially when symptoms come and go. Saving it means you'll have guidance when you need it most. And if you want to keep learning how to protect your kidneys, reduce creatinine naturally, and make smarter decisions as you age, I invite you to subscribe to this channel. I share clear science-based medical insights focused specifically on kidney health, without hype, without shortcuts, and without unnecessary fear. Most importantly, I want you to remember this. Kidney decline is often silent, but recovery begins the moment you start listening and responding with the right care. As long as you are breathing, adapting, and learning, your body still has the capacity to stabilize and improve. Thank you for trusting me with your time today. Take care of your kidneys, and they will take care of you for years to come.